I started off in the medical device industry selling hospital beds for Stryker Medical. I did that for 5 years and had the opportunity to really learn all facets of the hospital environment. Selling hospital beds, I dealt with multi-million-dollar deals, call on every department from environmental services to biomed, IT, all the way up the channel to administration. I worked with nursing staff to train them on how to use the beds, bed alarms to prevent patients from escaping out of the bed and falling. The transition of the industry going from handwritten documentation to electronic medical records, which was a very exciting and fun time. I got to learn a ton about all the things that go into the patient experience and what the nurses have to deal with, all the protocols, turning the patient, making sure that they maintain a head of bed level of above 30 degrees to prevent pneumonia. And these beds were actually designed to have all kinds of tools and features to help the nurse to do their job better. And so I was intimately involved with training the nurses on how to use the beds and to make their jobs easier. Highly involved with the entire transition of taking old beds out of the hospital, transferring patients off the bed. These are very sick patients, especially in the ICU environment, but I was involved with coordinating all of those different steps and details of swapping out all of the hospital beds. Tractor trailer full of hundreds of beds.
Bed off the truck. Hey, I brought an extension cord. We're gonna
involved with training staff, morning shifts, night shifts, day shifts, and it was a pretty intense experience. But it was a good starting ground for me to then make the transition into selling OR equipment with Medtronic. I'm very fortunate to have the opportunity to sell two very cool technologies designed to, one, cut, and two, stop bleeding. Aquamanus was a technology, or is a technology, that uses RF energy combined with saline, and it's bipolar. Saline also helps to keep the tissue surfaces lubricated so that the surgeon can paint broad planes of tissue. Helps to conduct the energy so we get rapid hemostasis. And then the saline also helps to keep the temperature profile very low compared to your traditional modes of electric cautery that run at about 300 degrees Celsius. The Aquamanus stays at around 100 degrees Celsius. Traditional mode of electric cautery is monopolar, meaning that the energy is constantly running through the patient. Whereas with the Aquamanus, the bipolar nature of the energy, it dances between the tips of the device, not running through the patient. And why is this important? Is because the energy is controlled at 1 to 2 millimeters depth of penetration. If you were to take a cross section of a vessel, what we're actually doing to stop the bleeding is we're closing the vessel biomechanically, and this energy works on the collagen in the vessel to transform and shrink the collagen down to occlude blood vessels. Monopolar, that energy is not controlled, and it works at much higher operating temperature. So what it's actually doing, it's creating a scab, desiccating the tissue, pulling and extracting all the moisture out of the tissue and creating a cork in the bottle. Scabs can crack and rebleed, whereas the seal with the Aquamanus is much more pliable and much more sustainable through the entire procedure. Less risk for infection. It's no different if you were to burn yourself on the outside of your body. The higher the temperature, the greater the inflammatory response that your body is going to have, and the more delayed wound healing that's going to occur. So these lower temperatures can help with wound healing and lower infection rates, and just a faster clinical pathway for the patient. But we've taken that energy and we've created many different hand devices to use throughout the entire body. The energy is indicated for soft tissue and cancellous bone throughout the entire body. And it originally started in solid organ. Total Joints ended up being a very, very good space for this technology. It worked very well in total hips and in total knees. But the precipice that really launched the technology to new heights was the transition of total hips being done from a posterior lateral angle to a direct anterior. That transition brought the incision more anterior and forced surgeons to dissect through the circumflex vessels. And this is a group of vessels that caused a ton of bleeding. So the Aquamanus was a great tool, a procedure enabling tool that allowed them to learn and adopt this new technique of doing hip replacements, because it didn't force the surgeon to dissect through huge muscle groups. The recovery process for patients was much more rapid. It lowered dislocation rates and greatly reduced the precautions that patients had to experience through the procedure. In total knee replacement, where surgeons have for years used a tourniquet to control the bleeding in the surgical site for doing total knees. Many studies showing that there's a lot of adverse effects that are caused from the tourniquet, DVT, a lot of muscle damage, muscle atrophy for the quadricep muscle, restricting the patient's ability to ambulate and recover after the procedure. Weight-bearing exercises and straight leg raises in order to get up and out of the hospital faster. But the tourniquet is proved to inhibit those motor functions. Using the Aquamanus intraoperatively to control that bleeding, drive patients up and out of the hospital faster.
What have you seen since you stopped using the tourniquet?
People have much less thigh pain. In fact, many of them are able to walk the same day of the surgery.
Same day of surgery?
And before, they'd be miserable and having pain from the tourniquet. But they don't have tourniquet pain, and because we're using a adductor canal block, they also have motor function, so they're literally able to get up and walk the same day.
What about drains?
I don't use drains anymore. You can see a little bleeding, and that hasn't been a problem either. With using a tourniquet, I always use a drain. They all feel dramatically better because they wake up right away in the recovery room, and when they're on the floor, they can move their leg and they go, I can't believe I have no pain.
The patients can leave the hospital faster too, right?
Well, absolutely. They're even staying for 24. They probably could go home earlier, but I think I'm an older population. Clearly, they're going home quicker with less pain. That's the most important thing. And they don't have pain. And as you can see now, we're haven't even cemented yet, and they really don't believe it.
Yeah. Recapping this knee here,
yeah,
it's completely.
It does. Because when we start, we're all.
It's completely bloodless.
So as soon as we flex it. Perfect. Turn around.
And not only are we able to drive them out of the hospital faster, taking, in some cases, the patient length of stay from 3 days down to under 24 hours, we're able to direct that patient directly home versus going to skilled nursing, which is a huge cost driver, moving from a fee per service model to a bundled payment where there's one payment given, being able to reduce the cost on the post-operative side is a huge advantage for maximizing profits. Studies show that almost 50% of the total cost of a total joint episode is on the post-acute care side. There's a huge opportunity for investing in technologies like the Aquamanus to help keep the patient as healthy as possible and optimize their experience. Keeping that blood in the body is a major metric when looking at the health of the patient and their ability to recover from the procedure, and just make that patient feel better. And if the patient can feel better, they can rehab faster, they feel stronger. The Aquamanus also has a very nice utility for neurosurgeons and spine surgeons for big, large open spine cases, as well as minimally invasive spine surgeries. It's also indicated for brain tumors, difficult challenges during these long procedures with controlling blood in the field. Visibility for them is key, and the Aquamanus is a very nice tool for them to help keep bleeding at bay, not only in large open cases, but also in the smaller, minimally invasive procedures. The other really cool technology that I've had the opportunity to sell is called the Plasma Blade, and this technology dissects and protects a very similar theme to the Aquamanus, with the advanced energy, it working at a much lower operating temperature than the traditional mode of electrocautery used to cut. It has a thermally insulated tip design, and our pulsed energy platform delivers a high frequency energy. The energy is pulsed in a way that helps to keep the temperature profile very low. So focused and so precise, it combines the cutting performance of a cold scalpel with the electrocautery hemostatic effects of your traditional electrocautery. It blends both. You can go skin to skin through the entire procedure. Works very well in aqueous environments. Electrophysiology, working around leads, providing protection not only from a thermal standpoint but a mechanical standpoint. It also has an amazing impact for mastectomy work when surgeons are lifting the flaps and working with a very thin margin. The lower temperature profile can provide a lot of protection to those delicate skin flaps to preserve circulation, minimize the inflammatory response that the patient has in the body, reducing fluid buildup, minimizing drain duration, and really giving the patient a better experience overall. The Plasma Blade also has a very nice play in neurosurgery for surgeons doing ACDFs, providing protection around neural structures, cervical cases where they just want lower operating temperatures and less energy delivered into the surgical site for protection around nerves and critical structures. Plastic surgeons that are doing very finesse work, and cosmesis is a very critical factor. The lower temperature profile can really help with that wound healing for the patient and give a much more aesthetically pleasing result. So that is a brief review of the technologies that I've sold in my medical device career up to this point.